A hearty good afternoon and welcome to a session on how to get pregnant naturally. We are glad to have Dr. Aradhya Achuri among us today to help us understand this topic. There can be a variety of, there can be a variety of factors that we need to understand to support the approach to getting pregnant and even the average period of time to do so. So the doctor will help us in understanding this and a lot more in today's session of how to get pregnant naturally. Doctor, you have the stage.
Good afternoon, everybody. I'm Dr. Aradhya Achuri, fertility consultant at Apollo Fertility, Kondapur. Today, I'm going to be talking about how to improve your chances of getting pregnant naturally. Before we go forward, I want to just clear some things about what are the chances of conception in any given month. We have many patients who come to us saying that we've been trying for 2 months, 3 months, and we have not yet conceived. So, what is the actual chance of conception in a month? The chance of conceiving in a month is only around 10 to 15%. Even if everything is fine, your age is less than 30 years, the chance of conception is only 10 to 15%. It means if 10 people are trying to conceive in a month, out of them, only one or two are going to conceive in that month. The rest of them will have to try for more months. So, how long more? When they have 12 months of unprotected intercourse during the fertile period, 80 to 85% of the couples are going to conceive. It's the remaining 15 to 20% of the people who are going to require extra help to conceive. Then, when do we plan? Which is the best time to start planning for a family? I would definitely say whenever you are ready. But we also have to keep in mind that once you cross the age of 30, especially for a woman, the chance of pregnancy comes down. And once you touch 35, the chance of conceiving is going to come down more. For men, once you cross 35 to 40 years, the chance of fertility comes down. This is because in women, eggs are not produced every day. At birth, the ovary have certain amount of eggs in them which are going to come down with each year of your life. Once you cross 30, the number of eggs will come down. And once you cross 35, the decline is going to be steeper. So the more longer you wait, the number of eggs and as well as their quality is also going to be less. So now you have made up your mind. You want to conceive, you want to start a family. What do you do next? Is there any specific test that you need to get done? Yes. Complete blood picture to know how is your hemoglobin status, because unfortunately in India at least 70 to 80% of women are still anemic. This could be because of your diet or it could be because of excessive bleeding during your periods. But this is a very common problem. So I would definitely have anemia, which is low hemoglobin levels in your body. This may lead to complications during your pregnancy. Then comes tests like thyroid test, sugar test. These are the regular tests which have to be done before you plan a pregnancy. And if you have not taken vaccinations like COVID vaccination, rubella, or chickenpox, it would be a good idea to go ahead and get these vaccinations as well. And the same stands for men. There's nothing wrong in getting a complete health checkup before you plan pregnancy. For women, before you plan pregnancy, it is ideal to start taking folic acid so that there is less chance of having neural tube defects in the babies. You can start at least 1 to 2 months before you start planning a pregnancy. Then comes lifestyle changes. What to do and what not to do. Let's talk about what to do first. The first one of priority would be having a good diet. Being overweight when your BMI is more than 30 or underweight when your BMI is less than 18 is both harmful. This can reduce your chances of conception as well as increase your chances of miscarriage. You can, if you're overweight, it is a good idea to consult a dietitian and start having a exercise regularly and reduce your weight. Of course, it doesn't mean that you cannot start planning till you reduce weight. It just means that let it go hand in hand. Low BMI and high BMI both can cause miscarriages in the pregnancy. Food. When it comes to food, this is a very common question which is asked: what do we eat when we are planning to conceive? A regular, balanced diet is all you need. Indian diet covers almost all nutritions available. The only thing we need to keep in check is eating the quantity of food you are taking. Also, reduce oil content, reduce processed meat and processed food. They make sure you're having green leafy vegetable at least 3 to 4 times a week. More protein in the diet will also be helpful. Start exercising, at least walking, jogging, or any sort of exercise at least for half an hour 5 times a week. This can reduce your stress levels, release more endorphins, reduce your hormonal imbalance, and improve your overall health. There is no need to stop exercising or following your daily routine just after the ovulation. You can keep on doing whatever you are doing. We don't advise to stop exercising once your ovulation is done. If you're somebody who is undergoing a lot of stress right now at work or at home, start doing yoga or meditation. Start doing developing a hobby. Start something you enjoyed when you were in your childhood, like dancing, singing, whatever it was, painting. Something to take your mind off your stress and reduce the amount of stress. More stress can cause hormonal imbalance and can affect the egg and sperm quality as well. So now we are done with all this. You have made sure you are physically fit and mentally fine to start planning. How do you plan? To know how to plan and when to plan, you need to know which is a fertile period in your menstrual cycle. For that, what is exactly the menstrual cycle length? The first day of the bleeding is considered as the first day of your period. If you are spotting before that, it is not taken into consideration. The day when the bleeding actually starts is the day one of your period. If your period has started at 9 in the night, the next day will be taken as day one of your period. And the next month, whenever your period starts, that is the day one of your next cycle. The number of days between your first bleeding and the second bleeding is your menstrual cycle length. 21 to 35 days is considered normal. If you have missed one or two periods in a year, it is nothing to be get stressed out about. Sometimes because of physical or mental stress, your periods can get a little irregular. But if you're getting less than 8 menstrual cycles in a year, it has to be investigated. So now your cycle is 28 days. How do you know which is your fertile cycle? Out of 28 days, subtract 14. This will give you the day of ovulation. So you will be ovulating around day 14 to day 15 of your period. You can start having intercourse from the day 10 of your period every alternate day. And one more easier method to know when you're ovulating is having a look at your vaginal discharge. Just before your ovulation, 2 to 3 days prior to ovulation, your vaginal discharge is going to become thinner, clearer, stretchy. It is going to look like egg white. There is a lot more elasticity, and when you hold the discharge between your fingers and stretch, you can see that the strands are stretching. This says that your egg is about to release. You can start having intercourse every day from the next 3 days once you see this change in your vaginal discharge. Another easy way to do it is doing a urine LH kit. Urine LH kit will also predict when you are about to ovulate. You can do this kit from the day 9 of your period between 12 noon to 8 p.m. in the evening. Make sure that your urine is little concentrated. So I mean, you should not drink too much of water before you do this test, because once the urine is diluted, LH hormone won't be able to will not be picked up by the kit. When you see two lines on the LH kit, this kit is exactly same to the pregnancy kit. You just need to drop 2 to 3 drops of urine into the well. Once you see two lines on the LH kit, it means that you are close to ovulation. You can start having intercourse every day once you see this in the kit for the next 3 days. This will improve the number of sperms which are available so that the sperm can swim, go and meet the egg. Okay, so you're somebody who gets very freaked out and stressed out, calculating all these days, and performance can also be affected. Then, what you can do is just start having alternate intercourse from day 7 of your period, or at least twice a week, every 2 days apart, till you are sure that you're close to your period. Day 7 to day 20, or if your then comes the question of what to do when your periods are irregular. If your periods are consistently irregular, definitely go for an go and meet your doctor and get yourself investigated. The common cause of irregular periods are hypothyroidism, PCOS, high prolactin levels, low BMI, high BMI. These are the most common causes. Getting investigated and taking the required treatment can help you achieving your pregnancy much earlier and easier. Okay, so you are in a very busy career, or you are staying in a different city. The wife and husband are staying apart. So, how do you plan pregnancy in this case? Once they see that the follicle has grown to a good size, they can tell you this is a good time. You can go ahead and start having intercourse. This can reduce the stress and improve your chances of pregnancy. Then comes the actual act of intercourse. Many people have doubts about how to have intercourse. Is there any specific position which can increase your chances of conception? No, there is no specific position, but obviously it is advisable not to do it in a standing position. Is it compulsory to lie down once you have intercourse? Yes, lying down for 10 minutes may not harm you but may also increase the chances of conception. And one another doubt which we commonly hear is the semen leaks out immediately after intercourse. We have to keep in mind that the semen doesn't just contain sperms. It has other fluids also which serve as nutrition to the sperms once they leave the testes. This is the fluid which is going to leak out outside after the intercourse. The sperms are going to swim inside and enter your uterine cavity. So, yes, this semen is going to leak out. This is totally common and expected because they have nowhere else to go. 2 to 3 ml of seminal fluid cannot enter the body. It has to come outside. So, you need not worry if the semen is coming out. The sperms are still going to swim inside and go and meet the egg. It is always advisable to pass urine before intercourse and 15 minutes after the intercourse. This will reduce your chances of catching a urinary tract infection. You can wash with just regular water, but do not apply any soap. It's not going to affect your chances of conception if you wash it off. And when once for some people, the act of planning pregnancy, having intercourse on specific days can increase the stress. They may feel difficulty in performing on these certain days. In this case, it is better to get yourself tested to see if there is any hormonal imbalance. Diabetes is one of the most common causes of erectile dysfunction. So definitely go visit a doctor, get your thyroid test, sugar test, get checked if you have diabetes, prolactin levels, and testosterone levels. Taking testosterone directly can impair the spermatogenesis. This can reduce your count and motility. So please don't take any over the counter medicines to improve your performance when you are having intercourse. always consult a doctor and take the suggested medicines. So you have been trying naturally, you have been following all these instructions. So when do you need to get worried? When do you need to go and consult a doctor? Having unprotected intercourse during the fertile period for at least 12 months is what is advised. If you have not gotten pregnant during this period, it is definitely better to go and consult a doctor to see if there is anything else that has to be checked out. So, in this, after you have tried naturally for 1 year and have not yet conceived, the tests which we would usually suggest are semen analysis to look at the sperm number, count, motility, morphology to see if there is any issue with the sperms. Then, for a woman, what we would suggest is a transvaginal ultrasound to have a look at the uterus and the ovaries. We do know that once every month a single egg is going to be released from either of the ovaries. This egg is going to go and wait in the fallopian tube and wait for the sperm to come and fertilize it. This fallopian tube is very, very thin and cannot be seen on ultrasound. So, to know if the tubes are open or not, we would suggest a test called as HSG or SSG, wherein dye or saline is pushed into the uterine cavity and it is checked if if the dye or the saline is coming out through the tubes. Once the tubes are patent, it means that the tubes are healthy and the egg and sperm can meet each other. If there is any problem in the tube, like a block, the egg and sperm cannot meet, and therefore getting pregnant is going to be difficult. And other tests which we would usually advise are general routine tests to make sure you are physically fit to go on and get pregnant. And another test to know if the ovaries have good number of eggs is AMH. This will let us know what is the ovarian reserve, if the ovary has good number of eggs or not. If the number of eggs are declining, it means that you need to get pregnant faster and not waste any more time. I think we have covered about most of the usually asked doubts when you're planning pregnancy. I would like to know if there are any doubts from the audience. Any questions in the chat? Great. So please let us know if you have any more queries and we can definitely answer them. Thank you.